break away from that initiative, inaugural event on minerals happening right now. And we want to talk to VA Secretary Doug Collins because it has been 1 year since he became the Secretary of Veterans Affairs. And this morning we want to check in the 1 year mark. And Secretary Collins, thank you for joining us here on Live Impact News.
Glad to be here.
You have been leading the efforts now to transform how America cares for those who have served our country. What are you looking like a year later?
Well, I think we've made a lot of progress. I think we started off by simply reminding ourselves here at the VA that the only reason we exist is the veteran. So when you put that first and you don't put the organizational priorities and the organizational structure and the organizational policies and procedures that a lot of times we're getting in the way of helping veterans, then you put the veteran first, then it's the whole way you look at it. So by doing that, we've been able to lower disability wait times, claims, getting them processed, from over 260,000 of the backlog to under 100,000. Our hospitals were opening more than 20 plus clinics over the last year. We're remodeling many of our hospitals. We're doing projects that are designed to take care of the veterans. So at the end of the day, it's about putting the veteran first. And that's been the biggest reorganization that we've had, is just a mindset of that we're going to live to standards.
Yeah, I mean, you serve, 9 million veterans annually. What do you see as the most pressing challenge these days?
I think the most pressing challenges is making sure that we're lowering the burden so that veterans getting the health care they need. There's still a lot of veterans who out there who don't take care or have not applied for their benefits that they've earned. And I think it's just making sure that we have the ability to reach out to those, especially our younger generation warfighter who is coming out of the military now, transitioning out. Those are the kind of challenges that we need to make sure that they have continuity of care, especially if they've experienced anything dealing with concussion, traumatic brain injury, or mental health issues that they need. We need to make sure that we're doing a good transition there so that the VA can continue to help them as they progress in life.
Trying to service everyone, how are you addressing the staff shortages, particularly when it comes to mental health?
Well, right now our staff, our mental health wait times have actually decreased, and others. I mean, it's an interesting line out there about staff shortage at the VA, but I have just an interesting statistic that says that in the last 5 years, we've increased our staff full-time equivalencies by 14%, while our actual workload has only increased 6%. So again, the before and after picture of the VA is that you had to have a lot of people and you had to have a lot of money thrown at problems, but yet we saw our wait times increase and we saw our backlogs go up. And what we're seeing now is if you put people in the right places and you give them the right direction, we're able to make changes. And I think that's the big difference now. We're not as concerned about how big we are. We're concerned about what kind of outcomes the veterans are having.
Yeah, and there's also an ongoing debate about the privatization of VA care. How does the role of community care compare with traditional VA care?
Well, there's no debate about privatization. It's not happening in the VA, and that's something people talk about when we say community care. But the law of the Mission Act from a few years ago says that veterans who are a certain distance away from our hospitals or in the wait time to get in to see a doctor, they can choose to go into community. We've actually made that easier by letting doctors have best medical interest and say between the veteran and their caregiver, it would be better for them to get care closer to where they are or outside the facility. That's simply the duality of who we are at the VA. It's not privatization. It's not anything we do direct care. I have many patients who get direct care services from our medical center, but yet have an orthopedic doctor who takes care of them on something else outside the VA. So it's really a symbiotic relationship that follows the law and allows us to treat and help our veterans in the best possible way.
Looking ahead to this next year, what would you consider a successful time as your tenure so far?
I think continuing the process of what we're doing is focusing on veterans, but also looking at our reorganization of our healthcare system, which is designed to put the hospitals and the clinics at the tip of the spear instead of being sort of spread out, left on their own with a vast bureaucracy above it that can't give it answers, can't give policy directions. We're reorganizing to where everything else is now supporting our 170 plus hospitals, 1,200 clinics, so that they're able to do what they need to do more efficiently, just as we have been at the Benefits Administration, getting the wait times down, making it easier for folks to apply for the benefits that they've already earned.
And Secretary Collins, I must ask, following the events in Minneapolis and the shooting of Alex Preddy, VA staff, are there concerns from other VA staff when it comes to taking care of our veterans?
No, and the tragedy that occurred there, and my condolences go to the Preddy family and to our wonderful workers in Minneapolis, and we're continuing to give them all the help that they need to process this very tragic situation. But I will have to say, even in Minneapolis and others, our veterans are still getting the best care that they possibly can by a very well-dedicated group of workers.
If a veteran is watching this right now, what do you want them to know about their situation if they're struggling with getting care?
Well, if they're struggling with getting care, it's just call. Let us know. I mean, dial 988. They can call the crisis line, and we can get them to someplace. If they're having trouble finding where to go, they can go online. They can go to my social media and comment. Send a message on my social media. Go to va.gov. They can go to 1-800-MY-VA-411. There's a lot of ways for them to reach out. Don't feel like they're having to sit there alone. They can actually reach out. Nobody should have to pay anybody. This is something else we need to think about. The VA services are here. We can access those for free. You don't have to pay somebody to help you get the services that you need.
All right. I hope our viewers know that, and a lot of resources there. VA Secretary Doug Collins, thank you for your time. Appreciate checking in.
Thanks, Jane. Appreciate it.